during, the COVID-19 days, in fact, I think it's here to stay for a while. What is the advice that you would give to parents? A lot of parents are freaked out. A lot of them don't even feel comfortable getting their kids to their pediatricians for their vaccinations. Can these vaccinations be postponed? Or would you suggest them coming in now? And also, how do they build the immunity of their kids?
COVID-19 is here to stay, and there's going to be a new normal. And the new normal is going to vary for everyone, but there are going to be certain norms that fit into this new normal, which is social distancing, wearing masks and masks properly, not below the nose, and hand washing, which is much better than sanitizers. But we have to have a fair amount of time and discipline that we have to build into our lives in terms of hand washing. So this has impact when we talk about the lives of children. They want to go to the park, they want to play with kids, they want to hug them, and, they want to play ball games and stuff like that. So they're going to have to do that with masks, not going to be able to hug their friends, which is a bit traumatic and a bit sad, but that's the way it is. In terms of immunity, we can make sure that they drink a fair amount of water, they eat nutritious diet, but honestly, other than vitamin C, which of course is fine to give, there isn't really anything in terms of enhancing the immune system that can actually battle COVID-19. So we need to be cognizant of that, and we do need to be aware that we need to take precautions for an extended period of time. Fortunately, COVID in children is less than 2.5% of all reported cases of COVID-19, so that's great news. Our children have milder manifestation, which is great news. In addition to the fever and just not feeling well, and a cough and a cold and a running nose, diarrhea and vomiting are common manifestations in children. And we have this rare inflammatory syndrome, and I know a lot of moms have read about it and seen stories in the West about what is like a Kawasaki kind of disease syndrome, where you get a rash, you get redness of the eyes, you get ulcerations in the mouth, you get raging fever, and these are manifestations of the immune system behaving in a particular fashion, which has been triggered by the SARS-CoV-2 virus. Again, very uncommon. So I think I would like to reassure parents in that COVID-19 in children is not a huge problem, fortunately. And the Kawasaki kind of presentation is very rare. And the outcomes in children who get COVID-19, by and large, is excellent. If, of course, they have underlying conditions like a problem with the immune system, or they have diabetes, or they have congenital heart disease, then of course it's tricky because these children are frail. In terms of vaccination, so we have to realize that the WHO, I think, brought out a report saying that they're very worried about diseases that are vaccine preventable coming back because vaccines are being given a miss. So, depending on the age of the child, little babies get diphtheria, whooping cough, tetanus, hemophilus meningitis, they get pneumococcal vaccination, they get polio drops, they get hepatitis B, slightly older kids get hepatitis A, they get typhoid, and so on, and chickenpox, MMR. So all these vaccines are important because they prevent vaccine preventable diseases. Now, we don't really want to have a situation where the child gets a vaccine preventable disease because we had a mental block about vaccination. You would have read about outbreaks with measles a couple of years ago in New York. Measles, chickenpox, they're a lot more infectious than COVID-19. So if someone gets it, then, it tends to spread very quickly. So vaccination, routine vaccination is important. We need to make sure that our kids get the routine vaccination. Now, it's best to get in touch with your pediatrician. Many of us have started doing a lot of consults virtually because it's just a lot more convenient, and quite often you can virtually provide a proper diagnosis and medication by doing a video consult. But for vaccination, there are some do's and don'ts in terms of, most of us are not letting too many people come into the clinic with the baby. We are sort of keeping a gap between two babies. We are making sure that the baby who's coming, or a child who's coming in for a vaccine, does not have any fever or any other symptoms. So there is a set protocol that most pediatricians have in place. So I think vaccination is something that can't be ignored. It should not be delayed. I think we already are playing catch up to about 2 months of delays, at least 4 to 6 weeks in most cases. So I think these should not be delayed any further. But of course, one needs to be cautious and one needs to have a detailed discussion with their pediatrician in terms of the precautions to be taken and what is the protocol for that practice and not to be casual. But vaccination is something that we need to look at. And while on the subject of vaccination, another question that a lot of moms ask is about when will we have a vaccine for COVID-19? There are 110 vaccine candidates as we speak. Most of them are in the lab or animals. There are about 5 human trials that are going on. A couple of them have moved on to phase 2, but please remember that there are 4 phases before a vaccine becomes available. It's phase 1, phase 2, phase 3, phase 4. Okay. Please, when you have done phase 3 trials, is really when you are able to bring the vaccine into the market. Now, usually it takes a few years for a vaccine from the time that it is conceived to the time that it's commercialized to becoming available. Now, that is going to become months instead of years, but realistically, and that is if any of these candidate vaccines turns out to be very efficacious, we are really looking at getting the vaccine next year. We are not going to get a vaccine in 2020. So let's not be too optimistic. And I know newspaper reports come in that some vaccines might become available by October, November. But how many doses? Who's going to get it? Which country? What cost? How efficacious? And we also have to realize that no vaccine provides 100% protection. And this is something that a pediatrician always explains to parents, that no vaccine provides 100% protection. Point number one. And there are certain vaccines that we've been, for certain bugs that we've been trying to create a vaccine that is durable in terms of provides protection, that is sustainable long term. Classic example, we do not have a vaccine against AIDS. We do not have a vaccine against hepatitis C. We do not have a vaccine against malaria. There are trials going on for vaccines against dengue, but at this point in time, we do not have a vaccine. So I think what we, and I really want to emphasize this, is that we need behavioral change. We need to adopt this new culture of safe distancing and hygiene and masks, because this is here to stay. We hope that we get a vaccine that's efficacious, and we hope that we get it soon.
Safe distancing would be the hardest among kids, though, once they get to school. How do they sit in a classroom? How do they play sports? How do they swim? How do they share a restroom? These are things that, it might be easier for adults to do, but to be sitting all day, 8 to 10 hours in a classroom with kids, at least 20 to a classroom, and playing sports. How is this a sustainable option for them, social distancing?
Preeti, you're absolutely right. It's very hard. And I think this is where, just like parents are talking to doctors and deciding what is, how to achieve this at home, I'm pretty certain that school principals and school owners and the board and the trust will be talking to pediatricians to how to do this, because they have to do this right. How are you going to teach them? How are you going to stagger classes? How are you going to stagger meal times? How are you going to stagger breaks? How are you going to manage the restrooms? Honestly, and it's not very far away. If you're talking about schools reopening in 2 months, I mean, I'm assuming that the vacation ends and schools reopen. There's a lot of work that needs to be done. We just can't let kids go out into a school bus and then carry on. I mean, you can't really expect a 5-year-old to understand all this. It's way too complex. So this really requires careful planning, and I'm sure through your fabulous Fit and Fabulous group, there will be parents who will take this to the school management to actually let's discuss this very carefully, and what are the do's and don'ts, and what are the norms, and how are we going to ensure all this. For example, small example, hand sanitizer in the reach of a child. What if he puts it in his eyes? If it's at a particular height and they just press and they play with it, splash, and it goes into your eyes. And so these are very little things, but one has to be very particular, in making sure that we do not put these kids anyway under any harm that might happen as we're trying to, protect the facility from COVID.
Doc, I know it might be too premature to ask you this, but when the vaccination does come out, would you feel comfortable giving it to kids? Because there are side effects of vaccinations too. Just something like the flu vaccination, a lot of parents are not comfortable giving it to their kids. Personally, I'm not comfortable even taking the flu vaccination myself. So I know it's premature, but when the COVID-19 vaccination does come out, do you think you'll be comfortable with it?
So that's a great question. And normally, whenever we give a vaccine, we have a very healthy discussion with the parents about, okay, this is what it's going to protect against. This is the likelihood of protection. These are the side effects. This is how long the immunity is going to last. And we will have to have these conversations again when it comes to COVID-19. This is the likely safety profile. This is the likelihood of protection. How long will the protection last? And of course, these are all new vaccines because normally, like I said, it takes years for a vaccine to become available. So we would have fast-tracked everything. So, what is going to be something that we see in the medium term in terms of side effects and stuff like that would not be known because the vaccine would just be very new. So there will be a lot of unanswered questions, and I think for anyone is administered the vaccine, there will need to be a very clear discussion, very transparent discussion. And I think therefore it is very important that we be realistic about the vaccine. I mean, it seems like, okay, the vaccine will come and, it'll be fantastic. It's not going to be the case. We haven't seen that. It took us years and years to get rid of polio, smallpox. So, I mean, these are very long drawn strategies in terms of, how many people need to get vaccinated, what is the kind of protective antibody people that you get and so on. It's a complex subject. And we've kind of looked at it in a very fleeting manner, and just because it appeals to us, and yeah, sure, it is attractive, we kind of